Hello and welcome to NU 621 Advanced Pathophysiology. I'm Dr. Nancy Tierney and I will be your instructor for the next 8 weeks in this course. I think you will be energized by the rapid pace and all that you already know and all that you will learn. I believe that advanced practice nurses will be front and center in the healthcare reforms that are going on and will continue for the next many years. The fact that you are here excites me, and I am honored that you are taking this course with me. So let me give you a little bit of my background. I am an acute care nurse practitioner. I currently work at the University of North Texas Health Science Center in the cardiology division. We are in Fort Worth, Texas. I teach in the Texas College of Osteopathic Medicine here at UNT Health Science Center. I received my Bachelor of Science in Nursing degree from Marquette University College of Nursing in Milwaukee. I got my master's degree in nursing at the University of Wisconsin-Milwaukee and my PhD at the University of Texas in Austin. I really enjoy teaching and learning. I believe I learn as much from you as you do, hopefully, learn from me. I'm a firm believer in taking time for yourself. This course, and if you are taking other courses, they also will provide a lot of stimulation and a lot of information overload at times. So be kind to yourself, give yourself a break, and take a deep breath. You're embarking on a journey that is lifelong and has tremendous rewards for the rest of your career. So it is important to keep your perspective, have your well-being, and the ability to learn will be enhanced by your treating yourself kindly. I want to give you a little roadmap for what you will be experiencing as well as what the expectations are for this course. You'll find that it is a rapidly progressing course, and I approach it from the 4 tasks that healthcare professionals, including advanced practice nurses, perform every day. You diagnose, you treat, you manage, and you explain why you're doing all of the other 3 things. Of the 4 tasks, advanced pathophysiology fits in number 4, explanation. Advanced pathophysiology is the explanatory piece of patient care. It explains what is happening and why it is happening. Specifically, it explains the symptoms the patient is presenting with, what changes are occurring in the body, as well as the basis for the disease and the diagnosis. I think you'll be amazed at what you already know and understand, and be amazed again at the detail with which you will become familiar. This course certainly requires a fair amount of memorization of facts, but I've tried to make it more meaningful. The assignments and discussion topics provide opportunities to apply the knowledge that you acquire here in patient care scenarios and in situations that you will encounter every day. You will notice that there are course objectives, unit objectives, discussion topics, assignments, and due dates. This is pretty standard throughout the courses here. So let's review the overall course learning objectives. Number 1, you will compare normal anatomy and physiology to alterations in function and regulation of body organs and systems in response to stressors. Second, you will correlate clinical signs and symptoms and diagnostic results with the development or progression of disease processes. 3, you will examine the way in which known or suspected lifestyle practices disrupt the normal homeostatic mechanisms of major organ systems. And 4, propose therapeutic interventions for identified pathophysiologic processes considering age, ethnicity, gender, and comorbidities of the patient. Each unit will have specific objectives. The objectives that you see here are identical for each unit. We will be covering 2 major systems each week, and the only thing that changes in the objectives for each unit is what is highlighted here in yellow. So in other words, when we are studying the nervous system, the cardiovascular and lymphatic systems highlighted here will change to the nervous system. So the unit objectives will have you identify normal anatomy and physiology of the system being addressed that week. You will list the risk factors for the most common diseases in adults and children. You will summarize the clinical manifestations for each of the most common diseases in adults and children. We will describe the pathophysiologic alterations that occur in the most common disease states in that system in adults and children, and propose therapeutic biopsychosocial interventions for the altered conditions for adults and children for each system. Each week, you will have discussion topics. There will be 2 focused discussions each week. I see these as a vehicle for you to interact with your colleagues. It's not so much for you to present more information that you have obtained from the textbook and whatever other sources you choose to reference. But I want you to take that information that you acquire, think about it, put it in your own words, and discuss and challenge your colleagues and yourself. There are weekly assignments, and there are 2 each week, except for week number 7, where there's only 1 assignment. Each assignment has multiple parts. Just be sure to address all the parts. I expect that it is written as a scholarly paper and not as a bullet-pointed outline. The more detail you give me, the better it is. You will notice that I will give lots of feedback, and my major question is why? Why did you say that? Why is that happening? So I want you to delve down deep and explain. And you will be graded on and expected to use proper APA formats. There are great resources available by clicking on the Library tab in Blackboard, and the librarians are there to help you, and they have provided great links for learning how to use proper APA format. Most of us don't memorize the formats because they do change. So when I write a paper, I keep it open and refer to it so I can write the references appropriately and use the correct format. There is a final project that is due midweek 7. In midweek 4, there is an outline of your choice of topic. The final project is a review of literature on a topic of your choice related to this class. There are videos provided in week 7 that help you learn how to write an outline for a review of literature, and then how to write the review of literature itself, because it's a little bit different than just writing a paper and quoting your sources. And again, the outline is due midweek 4. Please read the syllabus. You are responsible for its content, whether you read it or not, so please familiarize yourself with this. All the due dates are there for the entire 8 weeks. This way that you can organize your timeline and figure out what's due when and how to do things. The grades summary is included in the syllabus, and you will note that minimum grade for graduate courses is a B, which is defined as 83%. Please communicate with me. Call me. My cell phone is listed in the syllabus. You can send me a message through Blackboard. If you're having some difficulties or you have questions, don't wait. Don't think you'll be able to figure it out and take that chance. Just call me, communicate with me, ask me that question. I give lots of feedback. Don't be intimidated. I want to thank you for your time and welcome you to the course.